Okay, I'm getting ready to do my med pass for my first patient here. I'm just reviewing my doctor's orders, reviewing the medications. I got the right patient here. I've got Mr. Jones. Got the right medications here. So medications I'm going to be passing is Colace, hydroxyzine, Bactrim, and Pyridium. Okay, so I got the right medications, right patient. I've got the right dose. I've got the right time. It's 9 a.m. I've got the right route. All my medications are going to be PO this morning. And I'm going to document everything when I'm done. So I'm just reviewing my patient's charts, checking my patient's allergies, make sure my patient doesn't have any allergies that conflict with the medications I'm passing. Okay, that looks good. I'm reviewing any interactions between my medications. Nothing's interacting, so that's good. Reviewing all my labs, making sure none of my labs are out of range according with the medications I'm passing. Everything looks good on that as well. Okay, so I'm going to go ahead and withdraw my medications from Pyxis. Okay, got my medications here. Very good. Okay, so I'm going to go ahead and sign out. That's very important. And I am good to go ahead and go on to my patient's room. Okay. Got my patient over here in the corner. Alright, knock knock. Hello, Mr. Jones. My name's Taylor. I'm going to be your nurse today. I've got some medications to pass to you this morning. Wash my hands, provide privacy. I'm going to raise the bed up, make sure my patient's got a cup of water. And Mr. Jones, can I have your first, last name, and date of birth? Okay, do you have any allergies? No allergies? Okay. I'm going to go ahead and scan my patient's wristband. Beep. Okay, I'm going to head back to my computer here. I'm going to scan out all my medications. Okay, got my medications here. Okay, Mr. Jones, I've got 4 medications for you this morning. Your first medication is going to be Colace. It's a stool softener for that constipation you've been dealing with. So this is pretty much going to help you with the passing of a bowel movement since you haven't been able to pass one in a while. You might have some stomach pain, some possible diarrhea with this medication. So you want to make sure that we're drinking plenty of fluids with this medication as well. I'm going to assess the patient for any abdominal distension. I'm going to listen for the presence of bowel sounds. And I'm also going to assess the patient's stool once the patient does have a bowel movement. Okay, do you have any questions about that, Mr. Jones? No? Okay. Next medication is going to be hydroxyzine. So hydroxyzine, that's an antihistamine. That's going to be for the allergies you've been dealing with, especially with that itching. Some side effects you might see from this medication. You might get a little dizziness. You might have a dry mouth, possible constipation. So you want to make sure that you don't get up too fast if you're feeling dizzy. And for that dry mouth, I brought you some candy as well to help with the dryness. Also, after I give this medication, I'll come back and assess the patient, see if the patient still has some itching going on. Do you have any questions about that, Mr. Jones? Okay. Your next medication is going to be Bactrim. This is an anti-infective for that UTI that you have. It's going to fight against that bacteria. Some possible side effects from this medication might be some nausea, vomiting. You might have some diarrhea. It might cause a rash. So the patient's IV site, I'm going to assess for any infection or phlebitis, any rash, redness, swelling, anything like that. I'm going to monitor the patient's bowel function, assess for Stevens-Johnson syndrome. I'm going to monitor the patient's CBCs, and I'm going to get a urinalysis on the patient as well. Okay, the next medication I have is Pyridium. So this is a non-opioid analgesic, so it's a pain reliever for the pain discomfort you've been having with that UTI. The only real side effect you might see from this medication is bright orange urine, and that's perfectly normal. And I'm going to assess the patient's pain 30 minutes after giving this medication. Okay, do you have any questions about any of the medications at all? No? Okay. Got a glass of water for my patient. Okay, there you go. Patient swallowed all the medications. I'm going to lower the patient's bed. I'm going to open up the curtains. I'm going to ask the patient if the patient needs anything while I'm here. The patient is good to go. So I'm going to go ahead and wash my hands, put the call bell in reach. If you need anything at all, Mr. Jones, just give me a call on the call bell. I'll be right in. If not, I'll see you my next hourly check. Okay, wash my hands. Now I'm going to go document everything. My computer. Okay. Alright, so I'm ready to move on into my next patient. Okay, my next patient is Mr. Brown here. So I'm just reviewing my doctor's orders, reviewing my patient's chart. So, okay, I've got the right patient here, Mr. Brown in room 402. Okay, doesn't have any allergies, that's good. Okay, and I'm going to review my medications. So I have 4 medications to pass to this patient. Alright, I've got Miralax, I've got Benadryl, got Flagyl, and I also have vancomycin. Okay, so I'm just reviewing my patient's labs. Okay, all my labs look good. None of them are conflicting with the medications. Okay, patient doesn't have any known allergies. None of the medications look like they interact with one another. Okay, all the dosages seem to be good. My patient, none of my times are conflicting. So it's been long enough that my patient can have all these medications again. Okay, everything looks good. I'm going to go ahead and withdraw my medications from Pyxis. Okay, got my medications here. Just checking, making sure I got the right dosage of medications. Alright, none of my medications are expired. Okay, everything looks good. I'm going to go ahead and log out of the computer. Got my medications, so I'm going to go ahead and head on to my patient's room. Hello, Mr. Jones. My name's Taylor. I've got some medications to pass to you this morning. Wash my hands. Gonna provide some privacy. I'm gonna raise the patient's bed. Gotta make sure my patient's got a glass of water to drink. Mr. Jones, can I have your first, last name, and date of birth? Okay. Do you have any known allergies, Mr. Jones? Okay. I'm gonna go ahead and scan my patient's wristband. Okay. I'm going to go ahead and scan out all my medications. Okay, got my meds here. Okay. Are you comfortable, Mr. Jones? Do you need to go to the bathroom or anything? You're good? Alright, very good. Okay, so like I said, I've got 4 medications to give to you this morning. So I'm just going to go over the medications with all the side effects, tell you a little bit about it, and if you have any questions, feel free to ask, okay? Alright, sounds good. So your first medication I have for you is going to be Benadryl. So this is going to relieve those allergy symptoms that you've been having. Some side effects you might see from this medication, you might feel a little bit drowsy, so if you are, make sure that you don't get up or anything. If you need to get up and you're feeling extra drowsy, I can help you to the bathroom. You might have a little bit of dry mouth as well, so if you want some candy or you need something to drink, I'll make sure that I provide that for you. Do you have any questions about that? No? Okay. Alrighty, so your next medication I have for you is going to be Miralax. It's a laxative, so it's going to get rid of all that blockage that you've been having in your stomach. I'm gonna make sure that you got some water with that as well. So some side effects from this medication, you might have a little bit of bloating or cramping of the stomach. So I'm going to assess the patient for distension. I'm going to assess the COCA of the patient's bowel movement. I'm also going to check over the patient's electrolytes, labs, making sure that none of them are in balance. You have any questions about that medication? No? Okay. Alright, the next medication I have is vancomycin. So this is going to help with that staph infection you have. This treats life-threatening infections. So this is a strong antibiotic. Some side effects you might see from this medication: possible nausea, vomiting, phlebitis at the IV site. So I'm going to assess the IV site for any sign of infection or swelling, redness, anything like that. Possible side effect is hypotension. So you want to make sure you don't get out of bed too fast. Sit on the edge of the bed for a little bit before you get up. And I'm also going to assess the patient's renal panel because a possible side effect is nephrotoxicity. Do you have any questions about that medication? No? Okay, very good. Okay, the last medication I have is Flagyl. So this is an anti-infective as well. This is going to fight the bacteria of C. diff. So some side effects you might see from this medication is dizziness, headache, abdominal pain, nausea, vomiting. So I'm going to assess the patient for any rashes. I'm going to also assess the intake and output of the patient. So with that, I'm going to also assess the patient's COCA, the urine and stool, and I'm going to continue to assess for infection. Do you have any questions about any of these medications at all? Oh, you've taken them all before? Okay, very good. Alright, let me get you a glass of water here. Got your pills. Gonna go ahead and give you that there. Got some water. Okay, I'll go ahead and hook up my IVs. There you go. Okay, make sure I don't have any kinks in the line or anything. Make sure that my medication is being given. Okay, I'm going to go ahead and lower my patient's bed. I'm going to open up the curtains. I ask the patient if you need anything. Do you need anything, Mr. Jones? Are you good right now? Oh, you're good? Okay. You don't need to go to the bathroom? Nothing? Okay. Very good. Alright, put your call bell right there in front of you, and if you need anything at all, just give me a call on the call bell. I'll be right in. If not, I'll check on you in an hour with my next hourly visit. I'm going to wash my hands. Okay, I'll see you next time. And I'm going to go document everything in my computer. Okay, looks good.